This slide shows treatment completion or post-molding stage with custom-made pre-surgical infant orthopedic plate with nasal stents or NAM device. In order to attain results of the treatment, post-treatment impression is recorded with heavy body rubber-based impression material, spreading it over the custom acrylic tray and inserting in baby's mouth, keeping forward posture and head bending down to avoid salivary inhalation and flowing back of the material in the throat. Cast is then poured to record downward movement of the premaxilla and to get cast photocopies for further analysis. Two measurements are recorded on baby's face as anthropometric measurements with vinyl scale, columellar length and prolabium length. These post-molding pictures of the baby show the effect of nasoalveolar molding ring plate. This device comprises two parts: the anterior acrylic ring with nasal stents that make an active component of the appliance, the posterior palatal plate that is passive component of the appliance. Effect of the ring activation is seen as retraction, derotation and downward movement of the premaxilla, bringing it back into alignment with lateral cleft alveolar segments. Effect of nasal stent activation is seen as nasal tip projection, columellar elongation, nasal dome elevation, and contouring of the major alar cartilages into convex form, which were flared at birth and stretching over the cleft. The palatal plate serves as an obturator, facilitating the function of bottle suction and swallow. Distinctive feature of the palatal plate is that it makes the appliance self-retentive and independent of extraoral means of retention. On insertion, the activated self-retentive ring plate exerts static distal and downward force on the premaxillary segment. Moreover, dynamic forces from the orofacial muscles during function of bottle suction and swallowing and distally directed forces from the tongue muscles may enhance the action of the self-retentive device. We can see the successful outcome of the nasal stent ring plate, which is custom made, simple in design, comfortable to wear and cost effective. Optimum time of molding therapy is 3 months after birth, utilizing malleability of the neonate cartilage and soft tissues. Treatment analysis. In order to quantify the effects of molding therapy with stent ring plate, measurements are recorded from the cast photocopies, from the actual cast and from infant skin. Cast photocopies are made from the pre and post treatment casts to perform cast photocopy analysis. 5 variables are used in this analysis: 4 linear and 1 angular measurement. Premaxillary retraction and rotation correction is attained through this analysis. The downward movement of premaxilla is recorded directly on the cast with soft vinyl scale, both pre and post treatment casts. The scale is placed vertically in the deepest base adjacent to the premaxillary segment, and measurement is recorded at the level of median landmark on the alveolar ridge of the premaxillary segment. 2 anthropometric measurements are recorded on baby skin with vinyl scale for columella and for prolabium length. The columellar length is measured from the base of the columella to the apex of the nostril, and prolabium length is measured from the base of the columella to the lower margin of the vermilion border. Results are based on the measurements from pre and post molding records and tabulated. A total of 8 variables are used in this study, comprising 7 linear and 1 angular measurement. Retraction of premaxilla attained is 4 mm, downward movement of the premaxilla 3.5 mm, columellar increase right side 3 mm and left side 3.5 mm, prolabium length increase 3 mm, intercanine, intermolar, intertuberosity more or less the same, maintaining arch perimeter, rotation correction, which is angular movement, that shows a difference of 3 degrees. Custom-made self-retentive pre-surgical infant orthopedic plate with anterior ring and wire nasal stents in bilateral cleft of the lip and palate infants facilitates function, accomplishes retraction and alignment of the premaxilla without using extra oral attachments, induces non-surgical columellar elongation without additional scarring consequent to surgical retraction of premaxilla, improves nasal tip projection and elevates alar dome, normalizing nostril anatomy, provides precise and tension-free initial lip repair with minimal scar, and the appliance is cost-effective.